such a big anniversary. I mean, 125 years is a long time to be around as a hospital.
Those nuns came here with a spirit of compassion and sacrifice to take care of sick patients.
Things have changed. The building technology certainly has changed.
The thing that really hasn't changed so much is the one-on-one interaction.
Best technology and the best nurses and the best environment for physicians to provide the best care possible.
The sisters that started here came with a mission. That mission continues today.
Welcome back into Good Morning Arkansas. Some call it the winter blahs, but seasonal affective disorder, commonly known as SAD, is more than that. In fact, it is a form of clinical depression. This morning, Dr. Morgan Sauer with the Longevity Center at St. Vincent is here to tell us more about SAD, some of the causes, symptoms, and the treatment for this as well. Good morning to you.
Good morning to you.
Yeah, it is one of those things that it just happens to a lot of people, and you sometimes think, oh, I'm just kind of, bummed out about all the shopping that I have to get done, all the money I have to spend, all the people that I have to find time to visit. But it can be more than just a little frustration or a little depression.
It can be a lot more. Seasonal affective disorder can actually affect about 6% of the population. And it's not a kind of a one-time occurrence. It tends to be a more cyclical thing. It starts usually around December and can last into later spring.
Talk about some of the symptoms of SAD.
A lot of them are very similar to depression. Decreased energy, increased fatigue. Typically, you become more sleepy. Sometimes in depression, we become more anxious and have difficulty sleeping.
Right.
SAD patients will typically want to sleep even more. They may have an increased appetite or a decreased appetite, but usually going more toward the increased appetite. Kind of what we call a melancholic type depression.
Gotcha. It's the changes that we're talking about. You're going to see some drastic changes in your normal behavior.
Yes, and it's based on the calendar.
Okay, and so those symptoms could be the same as other medical problems, as we know. So how do you know the difference? How do you know this is seasonal affective disorder? It's
important to get a good physical examination and to also get appropriate testing to make sure this is not another problem that you mentioned, like hypothyroidism, low folic acid levels, low vitamin B12 levels, abnormal blood sugars for diabetes. We know a lot of people have diabetes, chronic fatigue syndrome. So you've got to tease out. Seasonal affective disorder, there's not a test for it, so you've got to rule out everything else so you can rule this in.
When you talk about seasonal affective disorder, does it sometimes take people years to figure out they have this because it is cyclical?
I have seniors that have had this for an entire lifetime and nobody recognized what it was. And they would dread the coming of winter. The holidays were just agonizing for them. They enjoyed the holidays, but they knew how they were going to feel for the next few months.
Who's most likely to experience this?
Actually, it's kind of across the population. You can find it in men and women. You can find it in older and younger. So it needs to be aware of all age ranges.
What causes seasonal affective disorder?
That is a great question. There may be a hereditary or a genetic component to this, but we also see it spontaneously pop up. Why does one child have it and the other 3 children don't have it? So you never know.
And then talk a little bit about the treatment. So if you think you do have this, you can go see a doctor, obviously. And then what would you do if you had a patient that has this?
There's several things that you can do. First of all, we know that seasonal affective disorder can be affected by melatonin and serotonin and some of the depression type chemicals, because it is a form of depression. There have been studies that looked at using antidepressants in the fall, kind of getting pre-treatment, because you're going to need 6 to 8 weeks before the antidepressants to really reach their full effect. Pre-treat in fall so you can help in winter.
So if this is something that you seem to have experienced year after year, go on in early, like you said, in the fall and seek some treatment. That's going to help you later on when that really does hit in the winter.
Yeah, and then when late spring comes around, you can actually get off of these medications.
Okay.
This tends to be based on sunlight, and we know that people who are exposed to light actually do well. So there are light boxes that can be utilized.
Light therapy?
Light therapy can be used. It has to be used in the morning. If you do it in the afternoon or the evening, it's just like doing no therapy at all.
Wow.
But using intense bright light, not like the regular bulbs we use in the house, but really intense, that activates certain receptors in the brain that lets the brain know it's time to wake up, it's time to go, it's time to live.
Because we just don't have as much sunlight in the winter. It can be very dark.
It can be extremely dark, and we can do things in wintertime that don't help us. We don't have the ability to exercise. The weather gets bad. We're not doing the things we normally do. Our interactions with other people may be less, and also there tends to be a lot more drinking during the holiday season. Alcohol can certainly aggravate this.
All of those things can lead to SAD, but the good news, there is treatment. Dr. Morgan Sauer with the Longevity Center at St. Vincent. Thanks so much. As always, a great topic this time of year.
Wonderful to see you.
We are headed off to a break. We've got more of Good Morning Arkansas coming up right after this.